Hello friends, let us now learn some important points about biphasic study. Biphasic study of upper GIT. So in the biphasic study of upper GIT, this biphasic study will give good anatomic information and also it also gives good physiological information also. It is good accurate, it is well accurate when compared to single or double contrast studies. The main goal or aim of this double contrast study is that this double contrast study, see, if you actually see the main advantage of, the main aim of this biphasic study is that if you see in the double contrast study, because you are using two contrast agents, one is barium, other is the gas, and barium, both these will help in better mucosal delineation. The mucosa can be easily, or it is the best identified, that is best identified, visualized, and it can be analyzed better with double contrast study. Similarly, with single contrast study also has one good advantage. Single contrast study will help in good distension of the stomach. Okay, there are two things which you have to see. That is, one, the stomach has lots of rugae. So it should be distended enough so that the rugae, all mucosa is seen. Okay, by distension, the whole mucosa is seen. That is number one. Once the mucosa is seen, the whole mucosa which is seen, it should be coated with barium. So this coating, this better delineation or better understanding the mucosa, this is done by double contrast study. So by using this biphasic study of upper GIT, we can have the best imaging technique ever possible for stomach. So what is the contrast medium used? In contrast medium, we use both barium and gas. So here we used 60 to 100% low viscosity barium is used. So low viscosity barium is used as 20 to 100 ohm. So how much of barium is used? We use 200 to 250 ml of barium sulfate is given orally. Along with this, you give gas forming powder. Okay, both these are given. Okay, you give low viscosity barium and followed by that you give gas forming powders. And after that you will have to take the X-ray films. First, you should take duodenal spot film. Duodenal spot film is taken first. Why? Because you should avoid the flooding of bowel. If you do not take duodenal spot film, all the distended stomach, uh, contrast comes into the duodenum, and so we cannot see the duodenal mucosa clearly. So as a result, first we will have to take duodenal spot film. Duodenal spot film is, first we will have to take prone, oblique, right side down position. Prone oblique right side down position, we can visualize the duodenal cap and also C loop. Okay, in prone oblique right side down position, a duodenal cap and C loop can be seen. Similarly, in supine with right side up oblique, supine with right side up oblique, we can see the duodenum. Okay, so the first film which is obtained is duodenal spot film. This is done to avoid flooding of the bowel. The next film, this duodenum, we have to see duodenum cap and C loop. These are seen in prone oblique right side down view. The duodenum is actually visualized in supine with right side up oblique. I could not find these images, but once I find these images, I'll upload one more video with these images and better technique. And erect, the next is we have to take an erect view. For this erect view is mainly taken for gastric fundus, followed by which we will have to take a supine view with head and 60 degrees head up. Supine view with 60 degrees head up view is taken for upper body of stomach. This is taken for upper body of stomach. Then a supine view, normal supine view is taken for lower body of stomach. It is taken for lower body of stomach and also pyloric antrum. It is taken for lower body of stomach and pyloric antrum. And then we have supine with right side oblique. Supine with right side up oblique. This is mainly for pyloric antrum and canal. This is mainly done for pyloric antrum and canal. Okay, so this biphasic examination should be done quickly without wasting time. It should be done quickly. This is one important thing because more and more gas and barium may be required for doing this doing this biphasic contrast study of upper GIT. So thank you.